Hello everyone, it's Max and I am terrible about doing videos, but what's new? So this is my 14-week video. I've been on T now for 3 months and a week, I guess, because it was April 30th was my first injection, and it's now August. Holy shit, it's crazy. So I think I might switch to doing kind of every 2-week videos because everything's sort of slowing down a little bit, but we'll see. I mean, kind of as I think of things to talk about, because that's really what the problem is I'm like, I don't know what to talk about, I don't care. So, physical changes, or I guess, well, first of all, I switched to doing self-injection, which is awesome, because I was getting, like, really impatient to do that. I don't know what to do with my legs. Fidget. What? Shut up. Don't laugh at me, Crystal. So I switched to doing self-injection. Did my first one at the doctor's 2 weeks ago, and then the other ones I've done from home now. So that's 2 that I've done from home. And the first one, on my first try, because of course I did, because I'm Max, I hit a bleeder, and it like shot like 3 inches in the air, and got all over everything. Which is just, because of course it did, because I couldn't have done it any other way. If we're being really honest, that's just kind of my style. Second time, fortunately, better. I've been doing some research on trying to figure out how to kind of minimize pain with the IMI injections. Because the first few times, like when they were doing it in my hip at the doctor's, and that didn't bother me, but for some reason doing it in my quad, or my vastus lateralis rather, has been pretty painful. And it always starts like about 12 to 24 hours after, and it feels like a sprained muscle. Which is apparently a fairly normal reaction the first few times that you inject into a muscle, because it's not used to having anything in it, because it's really kind of, technically, any intramuscular injection is an invasive procedure. So basically they recommend a couple things with the way that you do the injection to minimize pain, and then like doing massage or heat press to kind of reduce any crystallization. But if there, any trans guys watching this have some advice for me, that would be awesome, because it's been pretty moderately painful, like a bad muscle pull, and it usually goes away after a few days. It's not like an abscess or an infection. It's like it feels like a bruise or a muscle pull. That said, today, like, I'm alternating legs, of course, and I did my injection yesterday, and it hasn't been painful today, so I'm kind of knocking on wood that maybe it was just because it was the first couple of times that I'd done it. And I'm going to try, like, they recommended, I guess because I'm so skinny, it apparently seems to be the thing. Not anymore, which is hilarious to me, that I'm still too skinny. But they are having me, like, bunch the muscle up to do the injection, and different sources are saying that it's really better to, like, smooth it, or there's this thing, like the Z-Track method is another thing, which I guess is pretty popular in the UK, but not so much in the US, which the goal is to really move the skin and the sub-Q layer out of the way so you get a more direct muscle injection, whereas bunching it can actually make it harder to get it where it needs to be, because bunching it up is going to change where the sub-Q layer is. So I don't know, we'll try some experiments. It seems like there's not, I mean, beyond like a few things that you can do wrong, using those methods is just kind of a matter of preference from a provider. So since I'm providing my own health care in this case, it seems to be my preference. Yeah. So they also gave me like only a 1-inch needle instead of like 1.5. Because again, that I guess the skinniness factor, that they didn't think I needed the 1.5 inch, but that could also be affecting where I get the injection. So we'll see. Never really would have thought I was going to find myself on bodybuilder steroid websites, but there you go. It's in my Google history. Here's looking at you, FBI. What else? So 14 weeks, physical changes. At this point I feel like my voice is kind of starting to settle, but not drop quite as much anymore. So we'll see how that goes. It's definitely a lot deeper, undeniably deeper. There's no chance of really pitching it up, or else I sound totally stupid. So it's kind of cool. I'm also getting hairier and hairier and hairier, and I'm like, my God, when does it end? But it's cool. I like it. I'm just until it's kind of ridiculous because I was already hairy. So it's starting to, like, my belly is getting really hairy. My chin and my jawline is starting to fill out. And it's still, like, really fine, and I don't think you can see it very well from, like, a camera or the video yet, but it's there, I promise you. Starting to notice a few on my chest, but that's kind of slower. And I have one long black hair right there. His name is Boris. I don't know where he came from, but his name is Boris, in case you're wondering. You know, okay, that's pretty much it for physical changes. Continuing to bulk up. Really bad about going to the gym because I've still been in sale at work, which just ended. So I'm hoping to get back in the gym sometime this week, but I've been really bad about it. Anything else? I think that's pretty much it. That may be pretty much it for my video too, because I don't really have anything to say today. Like, I was trying to think of something to talk about, and I put off doing my video because I really wanted to have, like, you know, some topic to discuss. I haven't thought of anything. I'm going to be going back to that eating disorder group on Thursday, I think, just to continue developing, like, new routines of positive self-care. And it's been interesting as I've been kind of thinking about it more and more. I've also been noticing, like, other trans people who, like, have been just kind of putting that question out there, like, you know, how do I deal with the weight gain or the body changes from starting on T or on E? Because either way, it's going to really totally change around your physiology. Or not? Is that the right word that I wanted? Physiology? Physiognomy? Your body? Your body. Yeah, and it affects us equally and differently, but everybody gains weight, and it changes where you gain the weight and how you gain the weight. So I'm pretty excited to actually long-term maybe do a little bit more involved activism with helping out, reaching out to other trans people who have experienced or are experiencing eating disorders. So I used to be actually pretty involved in the eating disorder advocacy scene, and that was pretty much where I had a lot of attention with that when I was, like, in college, and have kind of backed away from it as different issues in my life became more important, and it seems to be circling back. So love to get re-involved in it and figure out how to help everyone feel confident embracing their body, no matter what, you know, size, shape, weight, height, but also gender, or gender representation, or agender. So everybody's got a different body, and it's always very interesting how we relate to our bodies. And as I said before, I think being transgender and having an eating disorder really brings those two things into a very different light. What else? It's really not a whole lot. Can't really think of anything. So please, if you guys have any questions, you know, feel free to put them in the comments, because I would love to really have a more interactive video blog going on here. But nobody seems to have anything to ask me, or else they just ask me on Twitter, and then I get into a long conversation there. But love to talk to you guys. Thanks for watching. Hope you're all having a fantastic summer, getting ready to go back to class, or whatever you're doing with your year. And I will talk to you either next week or in a couple of weeks. So, peace.